All right, folks, thank you again for joining us. A reminder that this Zoom conference is for press only. All of those who are logged in should change their login name to make sure it includes their media affiliation. You can do that by mousing over your name, clicking the word more, and then choosing rename. And you'll be able to use the raise the hand function starting now. Good afternoon again, and thank you for joining us. Today, all the speakers are joining us virtually to adhere to social distancing guidelines. And we will begin our briefing first with opening remarks from Mayor Kenny.
Thank you very much, Mike, and good afternoon to everyone. This morning, we received some very unfortunate news. An inmate of our prison system has succumbed to COVID-19. The individual was a woman in her 40s with underlying medical conditions. She was transported to a hospital last week. She had been under constant medical supervision, but despite these efforts, she succumbed to the virus this morning. Out of respect to her family, we will not be releasing her name, and I want to offer our condolences to her family and friends. As I said before, any death is tragic. I want to remind everyone that incarcerated men and women are human beings. They are someone's family member and friend, and we owe them the dignity of acknowledging their life and their passing. Philadelphia has been committed to criminal justice reform, and our focus on those reforms continues despite this ongoing crisis. I know this may raise questions about the procedures that the Department of Prisons has in place to safeguard inmates against COVID-19. To that end, I have asked Commissioner Carney to join us on the call today, and she is available during Q&A to answer questions from the press. But I want to make it clear to a couple of things. First, the Department of Prisons has been from the start extremely proactive in establishing procedures and protocols for this virus. They've done so working in concert with the Philadelphia Department of Public Health. Among these procedures are screening questions from the Centers for Disease Control used in the intake and medical screening process. The department has also created a response protocol for Philadelphia Department of Prisons clinical staff if signs or symptoms of the coronavirus are suspected in an inmate. The death of this woman is heartbreaking, as much so as the 206 Philadelphians who have succumbed to this virus so far. But I am confident that these procedures are sufficient to safeguard the health of all individuals in detention as well as our staff. My second point is about efforts to reduce the jail population in the midst of a pandemic. I've said many times before, and I'll say it again, I, as mayor, do not have the authority to release an inmate. Only a judge can do that. However, our partners in the criminal justice system, the First Judicial District, the District Attorney's Office, and the Public Defender's Office have been holding virtual hearings in municipal court for several weeks to expedite the release of inmates held for low-level offenses. These efforts have already borne fruit. The total population of the prison system has decreased 13% in less than 1 month, from 4,717 on March 16th to 4,087 this morning. I thank everyone involved in this effort to reduce our jail population and to do so in a thoughtful and deliberative way. As you may know, it's been a priority of our administration since day one, and I'm proud to have reduced the prison population by nearly 50% since the year 2015. We had over 8,000 prisoners and 8,000 people in our jail system back in 2015, and today just over 4,000. And we closed the House of Correction. So I wanted to make those comments and give our condolences to this lady's family. Now I'll pass on to Dr. Farley for the update for today.
Good afternoon. Thanks for joining. The news today on the epidemic is mixed. We are still seeing a stabilizing of the daily case count of the coronavirus infection in the city, but we're seeing increases in the number of cases in our hospitals. So more numbers now. Since yesterday, we've had 317 new cases of the coronavirus infection reported in Philadelphia residents, bringing us to a total of 7,130. Now, the daily number of 317 is a good bit lower than we had yesterday or a previous week or so, but it appears that not all laboratories are reporting all of their test results today. Not quite sure why, but a daily count that I'm reporting is maybe falsely low. We'll learn more about that in the next day or so. Still, I think that's evidence that we are flattening the curve with our social distancing work that we're doing around the city. And congratulations to everyone who is following those recommendations. Now, I know many of you are very interested in the racial distribution of the cases. So my staff has worked to try to match the cases we have in our database with other databases to pick up that missing information. And we can report out that information today. So here's what we know of the 7,130 cases reported in Philadelphia residents to date. 34% of them we still do not have race or ethnicity information on. So they're unknown. They could be of any race or ethnicity. So remember that when interpreting the rest of the numbers. 40% are known to be African American. 14% are known to be Caucasian. 6% are Hispanic. 2% are Asian. And 2% are other race or ethnicity. Now, we are still working on with a variety of different congregate settings around clusters of infection, including the city's jail. Currently, there are 54 inmates in the city's jail system who have the coronavirus infection. That's because of one new positive since yesterday, but 13 others who have recovered and been removed from isolation. Now, going to our hospitals, the cases in our hospitals is growing. In the city, there are 757 patients with this infection in city hospitals. And in the Philadelphia region, it's 1,361. Those are all somewhat increased from yesterday. I spoke to the chief medical officers of all the major health systems on the phone yesterday. All the hospitals are busy. Some of them are treating dozens of COVID patients. Some of them are closer to capacity than others, but all of them are able to handle it. Region-wide, about 37% of our hospital beds are still available, and 30% of our intensive care unit beds are available. As far as our deaths overall, we've had 16 additional deaths from the coronavirus infection since yesterday, bringing us to a total of 206. 103 of those, or 50%, are nursing home residents, and 136, or about two-thirds, are in people over the age of 70. The racial breakdowns of people who've died from this infection are on our website, but the mortality rate among African Americans is 1.6 per 10,000 as of today, and among whites, it's 1.2 per 10,000. Yesterday, I said the numbers that were out of date, but I think I'm accurate today, and that's the numbers that you should be seeing on the website very soon. Update on testing, we're pretty much have the availability we had before. It's available, but on a limited basis for people over the age of 50 with symptoms or for healthcare workers with symptoms. If you go to phila.gov/COVID, you can get information on all the different sites where testing is available. Now, despite the better news, it's still very important for people to be serious about staying safe. The virus is still circulating in the city. Even if it's circulating at lower levels, it's still out there. And there's no question that if we started behaving as we were before, the virus will surge again and then we'll have problems in our hospitals in the future. So stay home. If you have to go out, for example, for work or for a grocery visit, keep your distance. And when you're around people, wear a mask. Now, one other little point I want to make while I'm on this is that, coronavirus infection is much more serious in people who have been smokers. If you smoke, you damage your lung, and that damages the ability of your lung to fight off the infection if you were to get it. So if you haven't thought about quitting yet, or if you consider quitting and haven't done it yet, now's the opportunity to think about doing it. If you want to quit smoking today, you're going to reduce the risk that you would have a serious infection if you were infected with coronavirus. There's lots of resources and support that we can offer you at the health department. So go to smokefreephilly.org. That's smokefreephilly.org for support in quitting, or call 1-800-QUIT-NOW. And for our general website for COVID is www.phila.gov/COVID. Or if you want medical questions answered, call 800-722-7112.
Mensaje del alcalde Jim Kenney para el martes 14 de abril del año 2020. Buenas tardes a todos. Esta mañana recibimos noticias muy tristes. Una interna de nuestro sistema penitenciario ha muerto como consecuencia de la COVID-19. Es una mujer de unos 40 años con condiciones médicas preexistentes. Ella fue transportada a un hospital la semana pasada y había estado bajo supervisión médica, pero a pesar de estos esfuerzos, falleció esta mañana. No revelamos. Las más sentidas condolencias van para su familia y sus amigos. Como dije antes, cualquier muerte es trágica. Los hombres y mujeres en la cárcel son seres humanos. Ellos son familiares y amigos de alguien, y debemos reconocer su vida y su fallecimiento con dignidad. La ciudad de Filadelfia se ha comprometido para efectuar una reforma penal y nuestro enfoque en estas reformas continúa a pesar de esta crisis de salud. Sé que este deceso pueda generar preguntas sobre los procedimientos que el Departamento de las Prisiones tiene para proteger a los recursos del COVID-19. Con este fin, le he pedido a la comisionada Carney que venga con nosotros el día de hoy y ella estará disponible para responder a las preguntas de la prensa. Y quisiera dejar en claro un par de cosas. Primero, el Departamento de las Prisiones ha sido desde el principio extremadamente proactivo para establecer procedimientos y protocolos para combatir la propagación del virus. He estado trabajando arduamente con el Departamento de Salud Pública de Filadelfia. Los protocolos establecidos incluyen el realizar preguntas de detección sugeridas por los Centros para el Control de Enfermedades cuando se admite a un interno. El departamento también ha creado un protocolo de respuesta para el personal clínico si se sospecha que un recluso porta signos o síntomas del coronavirus. La muerte de esta mujer es desgarradora, tanto como los otros 206 residentes que han muerto a causa de este virus. Pero estoy seguro de que estos procedimientos son los adecuados y suficientes para salvaguardar la vida y proteger la salud de todas las personas detenidas, así como del personal que trabaja en las prisiones. Mi segunda reflexión del día es sobre los esfuerzos para reducir la población carcelaria en medio de esta pandemia. Lo he dicho muchas veces, no tengo la autoridad para liberar a los reclusos y eso solo lo puede ordenar un juez. Sin embargo, nuestros aliados en el sistema de justicia penal, el primer distrito judicial, la oficina del fiscal del distrito y la oficina del defensor público han efectuado audiencias virtuales en la Corte Municipal para acelerar la liberación de los reclusos detenidos por delitos menores. Y estos esfuerzos ya han rendido fruto. La población total del sistema de prisiones ha disminuido un 13% en menos de un mes, de 4.717 reclusos el 16 de marzo a 4.087 esta mañana. Les agradezco a todos los que ayudan con esta iniciativa para reducir la población carcelaria. Y esta es la actualización en materia de salud al 14 de abril del 2020. Desde ayer se han confirmado 317 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 7.130 casos en la ciudad y este es el conteo de casos diarios más bajos y esto probablemente se deba a que los laboratorios no han proporcionado todos sus resultados y la ciudad continúa monitoreando de cerca esta información. De los 7.130 casos, esta es la información sobre la raza y la etnia disponible. 40% son afroamericanos, 34% de raza desconocida, 14% caucásicos, 6% hispanos, 3% de otra raza, otra etnia y 2% de asiáticos. Tenemos un nuevo caso de la COVID-19 entre los internos, con un total de 54 casos registrados. Hay 13 internos que se están recuperando satisfactoriamente y los hospitales están monitoreando el aumento de los casos. En total, hay 757 pacientes que están hospitalizados en Filadelfia y 1.361 pacientes en la región sureste de Pensilvania. Reportamos también 16 nuevos fallecimientos en Filadelfia. Un total de 206 personas han muerto por la COVID-19. 103 de estas muertes se han producido en hogares de ancianos. El 66% se ha producido en personas mayores de 70 años. Este virus no discrimina por raza o por género. La tasa de mortalidad en las comunidades afroamericanas es de 1,6% entre 10.000 habitantes. La tasa de mortalidad para las personas blancas es de 1,2% entre 10.000 habitantes. Las pruebas están disponibles, pero son limitadas. Usted puede encontrar información sobre los centros de pruebas en fila.gov/COVID-19, pestaña FAQ. Tenemos que respetar la medida de permanecer en casa para poder permanecer seguros, porque el virus sigue circulando en el ambiente. Si no respetamos la orden de permanencia en casa, el virus se propagará rápidamente. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos y utilizar máscaras de tela en lugares públicos donde las medidas de distanciamiento sean difíciles de mantener. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponible en 100 idiomas. Si tiene preguntas de carácter médico, puede llamar las 24 horas del día, los 7 días por semana, al 1-800-722-7112. Y esta llamada es gratuita. Gracias.
All right. Thank you, Armando. And thank you for joining our daily press briefing. If you have not done so already, please add your outlet affiliation to your name in the login, and all participants will be muted until we actually begin. Please remember that we have limited time during these briefings, so only one representative from each media outlet is permitted, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. For now, though, we start off with Annie McCormick of 6ABC.
Hi, Mike. Thanks. I have 3 questions. The first one is for the mayor or for Brian. I don't know if Brian's on the call. The FAA, there's emergency funding that was announced today, and it looks like it's from the CARES Act. And it looks like Philadelphia International is going to get $116 million. Wondering if that was a number that you were hoping for when you had been talking about the need for federal funding, and if that is going to help at all, in regards with the city budget, or if there's more that you were hoping for or need.
Brian, you have more on that?
So Annie, I can't speak directly to the funding and its impact on the airport, but I can say that the aviation fund or the airport funding is separate from our general operating dollars. And so that $116 million will certainly be helpful to the airport's operating, but it won't help with our underlying fiscal crisis that's coming up.
Okay. My second question is in regards to Philadelphia school taxes. It appears that they're still due tomorrow. Is there any flexibility with that, considering that taxes, federally and state have had some flexibility because of the situation?
Sure. So we provided guidance that anyone with their school taxes should continue to file for an extension, which would be considered, I think, until May 15th, if I remember correctly. And should pay what they owed last year. There are significant cash flow repercussions to the school district should those taxes not be collected or to some amount, certainly not necessarily totals. So in order to keep our school district afloat and our public employees paid, we do need to still collect those school taxes.
But you can get an extension until May 15th.
I believe it's May 15th, but that guidance is certainly on the Department of Revenue's website.
Okay, and last question for you. In regards to the PPA, the parking meters and ticket collection, any thought of returning that so that the city is able to benefit from that money? Or with the stay-at-home order, do you feel that it's counterproductive because maybe people aren't parking or driving around as much? My question, I guess, just if you're going to start doing it before the stay-at-home order is lifted.
I mean, I don't know about Brian, if you thought about this, but that's not top on the list with things we're dealing with. Certainly we can check with the parking authority and the revenue department and get back to you as to what the plans are. But when they're not being collected, it's kind of out of sight, out of mind.
Yeah. And just to echo what the mayor said, I think we have been in regular conversations with the parking authority and with their executive director. It is not at the top of their mind either. I think they're trying to make sure that their employees are protected. And they've also ran into a number of issues with some members of the public being less than appreciative given the current times. And so they just want to make sure that all their, both their parking enforcement officers as well as their impoundment officers are protected going forward.
Okay, that's all I got. Thank you.
Thank you, Annie. Next up is Mayor Rind of Plan Philly. And there we go.
Yes, hello. I don't know if Commissioner Farley is still there. I have a question for him. Given the 6-foot rule and the number of people out walking, would it be helpful to close more streets or create more neighborhood slow zones? Would that reduce infections or otherwise promote public health?
I think probably Brian Abernathy is a better one to answer that.
Sure. Thanks, Dr. Farley. So, Mayor, we are reviewing whether we open additional streets to pedestrian access. I think some of the challenges around that are certainly making sure that we protect our resources and specifically our police department resources. And so identifying those sites and also making sure that that isn't done in an equitable fashion. So we certainly see the large usage of the Schuylkill River Trail, Kelly Drive, MLK Drive, but we want to make sure that whatever we do is equitable across the city to provide all of our residents an opportunity to recreate outdoors. So that is something we are continuing to work through.
And to follow up, I wanted to ask specifically about neighborhood slow zones. I think there are a couple now in the city, or a couple that are being developed. Is Otis or the Streets Department thinking about creating any more of those, perhaps temporarily?
Not at this time. Neighborhood slow zones are really about making sure the traffic is calmed in order to protect pedestrians. I think anecdotally, we have seen much less traffic on our roadways. And we also have to consider resources. As the mayor has mentioned, as I think we have referenced, we are facing a significant financial issues.
All of the above.
All of the above. I'm trying to find the right word that doesn't. But yeah, we got some financial problems, and we're gonna have to work through those. And neighborhood slow zones cost money, and frankly, we're gonna have to prioritize all of our resources and all of our programs going forward. And I've got to pay my police officer salaries before I install new slow zones.
Great. Thanks very much.
Great, thank you, Mayor. And next up is Mitch Blocker of NBC 10.
Thank you. Mr. Mayor, you sent Congress a letter yesterday asking for help. I'm wondering, how much money does Philadelphia need to get back to even?
We don't know at the moment. Those calculations are ongoing, and we don't know we know generally how much we've spent, but we don't know how much we're going to spend as this moves on. How long does it last? Do we have to expand? Do we have to expand opportunity for service? So we'll have a number, hopefully by May, or a general number by May 1st when the new budget's submitted to council, and we'll have a bit clearer picture of what it is we need.
What have you spent so far?
I don't have that in front of me right now, but we've appropriated $85 million. I do not believe we're through that yet, but we'll probably go through it.
The countries and the cities that have had the most success in opening their economies have rigorous testing capacity. What is Philadelphia doing to increase its ability to test people?
Doctor?
Yeah, let me try to answer that. There are several things that are limiting our ability to test. And this is a big problem. It's a big problem in Philadelphia. It's a big problem nationally. There is a limitation on the number of swabs used to collect the samples. There is a limitation on how many tests a laboratory can do on a certain day. And then there's a very slow turnaround for tests. It may be 6 days for many of the large commercial laboratories, which are still doing the majority of our tests. All of those are greatly hampering our efforts to rapidly identify cases and to do the kind of contact tracing we want to do in the long term. So we are very interested in getting past that problem. We haven't yet. It really is dependent on the manufacturers who produce these laboratory tests to produce enough, not just for Philadelphia, but for the entire country. As soon as they are able to produce it, though, we are eager to do more testing and to do all the follow-up that would occur when we have a rapid result.
And one last question. How will the city collect, use, and protect any medical information that it does collect on people?
The city health department gets medical information on people with positive results and has for decades, maybe a century. For example, we get information on people with HIV, and there are a number of legal and practical protections to make sure that information is kept private, and we follow the same policies here.
All right, thank you, Mitch. Next up is Steph Yin of WHYY.
Hi, thank you. How many people are in the quarantine sites that the city has set up?
As of this morning, there were 44.
Sorry about that. Is that at the Holiday Inn Express, or are there other sites?
It's over 2 sites. The majority of those are at the Holiday Inn, which is for a general population. We do have a separate site for first responders, which we should be announcing more formally in the next day or so, as well as other hotels that we have lined up.
So you have plans to open multiple additional sites?
We have backup facilities available. So, certainly if the Holiday Inn fills up, we want to be prepared to have another site to move on to. And the same thing with first responders. And we're looking at additional sites for, say, families with children or single mothers with children. So we're looking at multiple needs, making sure that we can fulfill those needs with different sites.
All right. Thank you. That's all for me.
Okay, thank you, Steph. And next up is Charlene Santiago of Univision.
Hola, buenas tardes. Mi pregunta va dirigida al alcalde. En el día de hoy, un grupo a favor de la comunidad migrante en Filadelfia hizo un llamado nuevamente a la ciudad y a funcionarios estatales suplicando mayor ayuda financiera, sobre todo para aquellos que no cualifican para desempleo o el cheque de estímulo del gobierno federal. ¿Cuál es el mensaje para el alcalde nuevamente para ellos?
Gracias. This is a question for the mayor. Today, a group in favor of the migrant community in Philadelphia again has called for city and state officials begging for more financial support for undocumented community. What does that do not qualify for unemployment or federal government stimulus check? What is the mayor's message for them?
Well, we're doing our best to raise money through the PHL COVID Fund to fund organizations that have traditionally serviced the immigrant community and to try to strengthen those organizations so they can service folks better. I know there's some concern in the immigrant community, especially in the undocumented community, of seeking out official services. And people have raised the issue of writing actual checks for the city. I really don't ever see that happening looking at our financial condition at the moment. So if there's any help coming, it may be coming from the state or from the feds. But knowing the Fed's position on immigration, I doubt that too. So we have to continue to raise funds for nonprofits that deal directly with the immigrant communities, and we'll continue to do our best.
Nosotros estamos tratando de hacer lo posible para poder ayudar a la comunidad inmigrante y estamos tratando de juntar fondos a través del fondo del COVID-19 para proporcionarles a las organizaciones que apoyan a la comunidad los medios. Y estamos tratando de afianzar sus recursos. Sé que hay inquietud por parte de la comunidad inmigrante al momento de buscar servicios oficiales y nosotros vamos a ayudar con eso a través de las organizaciones comunitarias. Pero en cuanto a escribirles cheques, no creo que eso suceda sencillamente por la condición financiera de la ciudad, aunque vamos a buscar apoyo al gobierno federal y estatal en vista de la posición con respecto a la comunidad inmigrante. Dudamos que ese apoyo venga del gobierno federal. Así es que vamos a continuar tratando de juntar fondos para ayudar a las comunidades a través de las organizaciones de servicio social.
That's all I got. Thank you. Gracias.
Thank you.
Great. Thank you, Charlene. Next up is Manny Smith of CBS 3.
First question is for the mayor. We know the city does not administer unemployment funds, but we know that there have been significant delays in delivering and letting people apply to those programs. We've heard other mayors say they are concerned about their citizens running out of food because they're frankly running out of money. Is that one of your concerns? And just about unemployment funds getting to city residents?
Food security has been our concern from day one. We've delivered over 1 million meals over the course of this month or so, 5-6 weeks. We are in constant contact with the folks in the state to express to them that people are waiting, and there's been an historical number of people that have applied for unemployment, and I think the system's probably taking time to wind its way down. But we do have food service available for children at 80 different locations and at 40 different locations for families. Our website has those locations, and if people are out of food, they should go on Tuesday or Thursday, families, to pick food that last almost a week or a week.
Can you characterize some of your conversations with state legislators about?
I don't have the conversations with them directly. We have governmental affairs staff that talk to state Senate members and state House members in the governor's office and they understand and they're doing their best to get this resolved. This is an unprecedented crisis, an unprecedented financial crisis and medical crisis. And you can understand why systems that are not used to dealing with this would be slow. And we're trying to get we're trying to get our system straightened out, and the state's doing the best to get their system straightened out. I'd have no other answer other than we're going to try to get there as fast as we can.
Oh, that's good enough for us. Last question is that we are within the 90-day window of major city-backed summer events, including Welcome America. There's that major citizen festivals like Pride Week and Odun Day that will be happening in late June, early July. Has the city made any decisions on events that they run, like Welcome America? And what's the guidance you're giving to other folks who have these major summer events?
No decisions at this point. Obviously, the longer this lockdown out, the less likely that events close to where we are now might happen. The other issue is there are lots of people congregating together in very close proximity to each other, which is a recipe for disaster. So we'll look to our medical advice, the CDC, Dr. Farley, and to try to determine whether or not we should have these events. I certainly would be sad if we didn't have them, but I'd be much sadder if we started a new outbreak and have more people die.
Thank you.
All right. Thank you, Manny. And next up is Pat Loeb of KYW.
Thank you, Mike. My first two questions are for Commissioner Carney. If you can unmute her. One is, how many inmates have been tested? I know the doctor's been giving us a running total of how many are positive, but how many have been tested?
So to date, we have 88 that have been tested and 54 confirmed cases, current cases.
So 88 tested overall?
Yeah.
Okay, thanks. And we're hearing that because of the limited time out of cells for people that some inmates are struggling with depression and other behavioral health conditions. And I wonder if there's been any changes to mental health services in the prisons, or more services being provided?
So more services are being provided on the units. Our behavioral health rounds continue as we did pre-COVID. So we do have staff going around and engaging the population to observe for any behavioral health distress.
Okay, great. Thank you. And my third question is, it could be for Dr. Farley or maybe for Brian or the mayor. But given that you've said daily that there are clusters in congregate care, might it not be prudent to change the standards for testing in those places for getting quarantine space for people who've been exposed there?
Yeah, so Pat, we are working with all these congregate settings to try to contain the clusters in there and prevent further spread within that facility. That includes testing additional people. That includes, in some cases, quarantining people. So our criteria are different there than they would be in other settings. And we're doing what we think is appropriate, the best we can do to try to contain the spread in those settings.
Thank you very much.
Thank you, Pat. Laura McChrystal of the Inquirer is up next.
Hi. I apologize if you answered this at the beginning. My feed was not booting up right at the beginning. But the woman who died, who was an inmate, had she been hospitalized? And then could you answer, are there other inmates who were hospitalized, and how many?
Commissioner Carney?
Yes, she was hospitalized. We currently have 3 additional inmates that are hospitalized.
Okay, and the woman who died, I imagine you'll tell us that you can't give her name, but if you could you give it to us? And also, could you say at all what charges she was held on, or how long she had been an inmate?
Out of respect for the family who's grieving at this time, we will not release her name out of respect for the family. Since she was with us for approximately 500 plus days. And I will not comment on the additional information for the charges out of respect for the family.
Okay, thank you.
Laura, are you set?
Yes.
Okay, thank you. Next up is Denise Clay of The Sun.
Hi, I guess this question is for the mayor and Brian, if they can answer it for me. Is there, we've been talking a lot about, the holes that this has created in the city's budget. Are there any programs that are completely off the table or anything that's completely off the table as you remake the budget?
No, not at this time, but there's intense scrutiny of the budget that's going on as we speak. We will get to a point where the rubber will hit the road, and probably no one's going to be happy, and that's probably going to be the fairest way to deal with this unprecedented dilemma in our government finances.
Okay, Dr. Farley, I tried to follow as best I could when you were talking about the number of people in terms of race with the coronavirus that are confirmed cases. And particularly when it comes to who actually has it. Could you repeat those numbers for me real quick again?
Okay, I think we will have those on our website either today or tomorrow, but let me just read the numbers again in case we don't get them up until tomorrow. There were 34% of unknown race, 40% African American, 14% Caucasian, 6% Hispanic, 2% Asian, and 3% other.
All right, thank you.
Thank you, Denise. Martin Pratt of Philly YBN, you're up.
Hey, thank you for doing this. The healthcare workers have reached out to us and asked a question to be asked of Bryant, I guess, or the mayor. Are there any services that will be offered as we go back to flatten the curve and drill back to normalcy? Are there any services for mental health that's going to be offered by the city to city residents?
So we always have mental health provisions for our residents that's provided by the Department of Behavioral Health and Intellectual Disabilities. I think you're right. I think we're probably going to need to bolster those services, not just for our residents, but also for our own city staff. And we actually currently have a group working on that very topic to make sure that our staff are taking care of themselves, making sure our healthcare workers are taking care of themselves. And I know each of the healthcare systems are doing the same for their own workers. This is going to be a challenging time, and we're going to need to try and balance those extreme social needs and healthcare needs with the financial situation that we're going to face as well.
And lastly, can you give us an update on the school cleanup effort that's being started for the lead and asbestos?
I believe it has started, but I can't provide any more details. Let us get back to you on that.
Thank you.
Probably tomorrow we'll have something.
Thank you.
Or Martin, feel free to shoot an email to the press account and we'll try to get you an update in writing. Are you good for the moment?
Good.
Okay. Jack Tomzik of the Metro, you're up.
Yes, this is about the inmate who died from the coronavirus. Was she eligible for early release, and had she filed an application for an early release hearing?
Commissioner, do you know?
Yes, she was not eligible for early release. And I'd also like to update, we've had 120 cases tested since the beginning. I did receive my updated statistics. But this young lady would not have been eligible for early release.
Okay, thank you. That was my only question.
Okay, thanks, Jack. And Jenny DeHuff of Broad and Liberty, you're up.
Thanks. Yeah, this is a question, I guess, for Dr. Farley, a two-part question. I understand some healthcare workers were sent to the Leopold Center yesterday for training. Do you expect the Surge Center to be ready to take patients by Thursday if need be? And will volunteers and staff have the medicine to treat patients there?
We did have a number of volunteers from our Medical Reserve Corps who reported to the Leopold Center yesterday for training so that they could work in the facility if we need it. And we are on track for it to open on Thursday if we need it. It's still not clear if we're going to need it or whether the hospitals can manage their patients on their own. I can guarantee you that if we need it, medicines and everything that's necessary will be available there. We hope to not need that facility, but if we are, we will provide excellent care.
Okay, and just a quick follow-up. What's being done for the homeless who are COVID positive? Are they being taken to the Holiday Inn Express, or where are they being placed?
I think Brian might be better to answer that than me.
Sure. So for those individuals who are unsheltered and COVID positive, we are making sure that they seek medical attention. And so they are being provided emergency room care and at times admitted into the hospital. For those who are not showing severe symptoms, but have still tested positive, we do have isolation space within the Holiday Inn that some have taken up and are there until they stop showing symptoms.
I know there's some cases where there's psychiatric issues with those who are unsheltered. Is there anything being done for those who are homeless?
Sure. So at this time, none of the facilities we have online would be appropriate for some of those harder to handle and more challenging cases. But we are actively working. We've identified a site and are just working to identify a provider to provide additional services.
Can you tell me what site that is?
We are looking at an update on all of our quarantine and isolation space in the next day or so. So stay tuned.
Great.
Thank
you, Jenny. Yep. Next up is Kennedy Rose of the Philadelphia Business Journal.
Hi, this is a question for the mayor or Brian. Goldman Sachs today announced a $10 million partnership with the city of Baltimore to provide Paycheck Protection Program loans for small businesses in the city. Is Philadelphia working with any banks or financial institutions on a similar initiative?
Not that I'm aware at the moment, but we can check with our revenue folks and finance people to see if they're in discussion with anyone.
Okay, thank you very much.
Thank you, Kennedy. Pat Loeb is back for round 2. Hold on one second. There you go, Pat.
Carney. How many inmates are in quarantine?
So currently, the entire facility has been placed in shelter-in-place status, and that's across all of our facilities to help stop the spread of this virus that's pretty much across the country and the world. So that's how we're operating at this time.
Okay, but quarantine from each other. I mean, like with a social distance, that.
So, Brian, did you have a?
Yeah, I think, Pat, you're probably referring to the how many inmates are in the isolation space?
Yes.
And so we have 4 folks in the isolation space.
Okay, great. And do all of the inmates have masks of some kind?
Yes, they do have masks, and they've been issued and encouraged to wear them while they're in their cells, as well as for the limited time that they're out of their cells.
Okay, great. Thank you. And then I was going to ask Brian some more questions about that additional space you have, but it sounds like you're just not going to tell us till tomorrow. Is it?
Not yet. And just to give you some background, I think we're trying to finalize some additional leasing options, and we don't want to negotiate against ourselves or in public. And so we're trying to finalize that work and can roll out all that information at once. So we're not trying to hide anything, but we also want to make sure that we're protecting the taxpayer too.
Thank you.
All right. Thank you, Pat. Max Marin of Billy Penn, you're up. Go ahead.
This was just a clarification, and my signal was a little bad early in the call, but just about the inmate who passed away. What did they pass away yesterday?
Yeah. The woman passed away this morning.
Hello?
Hello, can you hear?
Hello?
Max, can you hear us?
Yeah, can you?
Yes.
Yeah, you can't hear me.
The commissioner made clear again the inmate passed away this morning. All right, Max, I think we're having a little trouble there. Let me unmute you one more time. All right, we're going to move on now to Brian McCrone of NBC 10.
Hello, everyone. Philadelphia has some of the lowest broadband access rates in households. And I was wondering, Comcast said back in March 16th it was going to provide free broadband for 60 days. And I was curious, two things. Have you talked with Comcast about extending the term of that beyond 60 days? And also, how satisfied are you with being able to, get needed safety information, service updates, coronavirus updates to city residents, especially in there's large neighborhoods where it's under 50% of homes, or roughly 50% of homes have like broadband access in the house.
Brian, you want to take that?
Sure. So we haven't engaged Comcast yet, but that is something that we're likely to do, as well as engage a number of our other internet providers. So Verizon's also offered some services. We want to make sure that everybody has access to these needed services. And at this point, broadband is almost like a regular utility. We need to make sure that people have access to information. On getting the message out, I don't think the short answer is no, we're not satisfied. And I think that's why you've heard us continuously say to text COVID PHL at 888-777. That text alert is really a lifeline. It gives you regular up-to-date information on exactly what's happening throughout. We'd also ask people to sign up for Ready Alert to make sure that any emergency information is also available for residents, and that comes through your text phone, or it comes as a text to your phone. So broadband isn't necessary.
Brian, you good?
Yep. Thanks a lot.
Let's try one more time. Max Marin to Billy Penn. See if you have a better signal there.
Okay. Hey, everybody. Sorry. Let's see if my Comcast holds up here. Brian, I know not to pressure you again about the second site, but this is just a side issue around that. Once this site is up and running already, will you be announcing at least the regular numbers of people in that site, considering the decisions not to disclose numbers around city employees and first responders?
That's a fair question. I'll probably, we haven't actually discussed it. We're likely, and those are not just all city first responders, to be fair. I think we'll have to have that conversation. I'll certainly be willing to update on overall numbers on all of our facilities, and whether we provide details of each individual facility. That's a fair question, and I haven't thought about it yet. So let us have a conversation, and we'll have a better answer for you tomorrow.
All right, thanks. This is a quick one for the mayor. The stimulus checks are coming in this week. A lot of people are using them to survive and get by, but I was curious, as some people have been speaking with, about what they can do with their stimulus check if they want to help others. What would you recommend people do?
The PHL COVID fund is probably the best place, centralized place, to make a contribution and to make sure that money, 100% of it, without any administrative fees, go out to people who are in need. Two organizations that have a real good reputation, have good reputations in serving the public, and it's been wonderful to see how corporate Philadelphia stepped up and how individuals have stepped up in large numbers. So if someone gets a stimulus check and doesn't need it, God bless them. But I would take care of your family and food issues first, and your rent and some of the other stuff. But there's a little left over. PHL COVID fund is the way to go.
All right, thanks, Mr. Mayor.
Max, are you set?
I'm good to go. Thanks, Mike.
All right, very good. And this is the last call for questions. We have a few more minutes left. So if you have additional questions, please raise your hand. And for right now, we'll go to Annie McCormick of 6ABC.
Thanks, Mike. And this is for Dr. Farley. I know earlier you said that it appears that the cases are stabilizing, but there's an increase in hospital cases. This is a question from our data journalism team at 6ABC. They're tracking it, and it shows that the suburban counties are flattening out in their number of cases, but Philly is still on the rise. Does that fall into what you're seeing and what you're talking about today?
Are you talking about just new cases reported, or are you talking about people hospitalized?
Cases reported.
it's reported. Well, in Philadelphia, we see increases and decreases each day, and it depends in part on what laboratories are reporting each day. Is not consistent. But overall, we've been pretty level for about the last week or more. So I would say that we're fairly stable. I haven't looked in detail around the suburban counties. I think the entire region is more or less stable over that period.
Okay, thank you.
Annie, are you set?
Yep.
Very good. And seeing no further questions, that concludes today's daily briefing. We will schedule another one for tomorrow at 1 p.m. Thank you.